Thank you, Steve. Well, muscular tension, arthritis, lower back pain, the long list of chronic pain goes on and on.
Yeah, and September is National Pain Month. This morning we are joined by Dr. Denis Patterson over Skype with how you can properly treat it. So doctor, for one, thank you so much for being here today. I guess my first question is, when you talk about chronic pain, is this the pain that just kind of naturally develops, like, oh, my back hurts, or is this pain that is caused by maybe you played baseball or something in college and your shoulder bothers you and then it just continues to bother you?
Yeah, so chronic pain can come from multiple things. One, it could be genetics. You may have inherited some bad genes from mom and dad, and you can thank them later. The second way is, you're exactly right. We go through life and we can suffer traumas. And after you have a trauma, unfortunately, you can develop chronic pain years later as a secondary form of arthritis that forms as a result. And then lastly, we are just active people. We do things every day. We bend, we twist, we turn, and unfortunately, that can take a toll on our body over time and eventually develop a chronic pain issue. If you look at it statistically, they say that every decade of your life, you have a 10% chance of developing a chronic pain issue.
Wow. So how many people in America are just living their daily lives with this chronic pain, and what should they do about it?
Well, when you survey Americans and you ask them if they have a moderate to severe pain issue that they suffer with daily, what you find out is that 28% of the country says they do. That's 100 million Americans. That is a lot. And when you ask them if their pain is properly controlled, they'll tell you that 40% of them says their pain is not, that it's not adequately being addressed or being done. And so what I think you need to do is, I think you need to talk with one of your physicians, whether it's your primary care doctor or internal medicine, and see if you can be referred to see a chronic pain specialist. I think they can help you out and look at different alternatives and ways to treat your pain that you probably weren't aware of that existed out there.
And are there any common things that people do in their everyday lives, whether that maybe be playing sports or even just the way you sit, that are common to cause chronic pain long term?
Oh, absolutely. You're exactly right. Ergonomics is important. And so when you're working, the way you sit at your desk, the way the computer screen may be positioned, the way your elbow is or your wrist definitely can lead to pain over time. And so, in our office, we even have brochures that we can give patients to look at how to set their work desk to make sure that they're not leaving themselves prone to getting this pain, chronic pain from just the positioning of their workstation. So absolutely. That's an important thing.
What is the proper way to sit at your desk? I mean, Sam and I have been sitting at this desk for like 4 hours, and before that we were sitting at our desks in the newsroom for 2 hours. What is the biggest mistake that you see people making?
I think it's the height of your computer screen. If it's not at eye level, unfortunately you end up looking down and putting stress on your posterior muscles of your neck. Or if it's, if you end up like having to hyperextend your neck back, you can make your that's exactly right. See, now you guys won't hurt yourselves because you guys are staring down that screen for hours on end.
Yeah, and what are some of the most common pain complaints that you see?
So the top 2 sources of pain and disability worldwide is, number 1, lower back pain, and number 2 is migraine. And I have to say that spinal pain is the biggest thing we see in our clinic. About 80–90% of the patients we see and treat have spine pain, and majority of that is lower back. And then we do have quite a bit of patients with migraine that we treat with treatments such as Botox to help get their migraines to go away. I think we inject probably between 500 and 600 patients with Botox a year just to treat their migraines.
Wow. And obviously talking to a chronic pain specialist is a great way to seek treatment, but are there other easy things maybe people can do at home if they are, having, for example, chronic backaches or migraines?
Yeah, I mean, I think with migraine, let's start with that. There are certain triggers. So sometimes caffeine or other foods that they eat may bring a migraine on. So I think you should look at your diet and see if there's anything that's exacerbating them. Second thing is lack of sleep. Sleep can lead to the onset of a migraine, and so getting a good night's sleep and being good about that can help out. And then lastly is hydration. A lot of times a headache or a migraine can be caused by dehydration, so make sure you stay hydrated.
So how long should people live with this before they decide to go to a doctor?
Well, I think anytime you have pain, you should, do the normal things, probably rest it, take it easy, and let pain be your guide. Don't do anything that exacerbates it, and see if it goes away over a couple weeks. If it doesn't, then you should probably seek medical attention.
Okay.
Awesome. Well, thank you so much.
Yeah, thank you guys for having me, Taylor and Samantha. I appreciate the time this morning.
Yeah, some very useful tips.
All right, we'll see you next time our backs are hurting.
Going to keep the
Gonna get
computers up from now on.
Thanks, doctor.
Viewers, bear with us.